This is a story about perspective. I know we have to consider multiple perspectives and weigh various factors when making big medical decisions, such as whether to continue with chemotherapy, for example. And I want to tell you a story about a patient I saw several years ago. It was a home palliative care visit. He was a patient in his 70s with stage 4 cancer. And he primarily sat on the couch staring off into space, giving maybe very short phrased responses. And so I primarily spoke with his wife. And he had just come home from the hospital after suffering complications from uh, severe dehydration, from nausea and vomiting from his last cycle of chemotherapy. And I asked his wife, "So, how are you doing? Like, how have you been coping with all of this?" And this strong woman, with her wall of stoicism, I just saw the wall just crumple. And she described an enormous feeling of guilt for having made the decision to agree with continuing with chemotherapy that resulted in her husband being hospitalized, an enormous sense of burden of trying to make these decisions for him, and an enormous sense of fear, wondering if he would suffer the same side effects the next time he underwent chemotherapy. And I try my best to reassure her to say, the best anyone can do is weigh all the data we have at the time and consider the realistic potential benefit against the realistic potential burden, and then make our decision. No one can predict the future. And then I asked her, at this time, what do you want most for your husband? And she said, I want him to be comfortable. I want him to feel safe and secure. I saw him in the hospital and it was a horrible experience. He was so anxious, he was so scared. And I don't want him to have to go back to the hospital. And I said, okay. And right now, what is this chemotherapy supposed to be doing for him? He has stage 4, so it wouldn't be for cure, but is it supposed to be shrinking his cancer, making it not grow as fast, trying to extend his prognosis from months to more months? And she said, I don't know. We never really discussed. His oncologist recommended that we start with this next line of chemotherapy because the others didn't work out. But I think I need to talk to him about these questions. And I agreed with her. And then she added, no matter what he says, I'm not sure I could even let go of chemotherapy. And I asked her, why not? And she said, because every time we go, his oncologist says he's doing better. He's doing better. He's doing better. And I said, okay. From what I've heard you describe how he was last year, beginning of last year, before he started cancer therapy, you told me he was driving, he loved to play ball, he was engaging with you and laughing. And now these days, he primarily sits on the sofa, staring off into space. He's slow to respond, doesn't really interact with you. And he walks on his own slowly, but you have to help him up. You help him use the toilet, you help him use the bathroom. So he sounds like a different person now than he was last year. Some oncologists, when they say a patient is doing better, they're looking at the CT scans and seeing the cancer shrinking or even disappearing. And I'm wondering, when your husband's oncologist says that he's doing better, are they looking at your husband, the man, the person, or are they looking at your husband's CT scans? And she replied, oh, definitely. His cancer doctor is looking at his CT scans. So she did have an honest, candid conversation with his oncologist the following week at her husband's appointment, and got the information she needed to weigh realistic potential benefit over realistic potential burden. And the following day, she called 2 hospice agencies to interview with them and asked them, how can you best help me accomplish my goals of keeping my husband comfortable and feeling safe and secure at home without having to go back to the hospital? And she picked one and enrolled her husband with that hospice agency. And she did it. For the next 4 months, her husband remained comfortable at home and did not have to go back to the hospital. And she thanked the palliative care team for giving her a different perspective and a bit more clarity. I hope this story also gives you that a little bit of clarity as well. Thank you for listening. I'm Dr. Jeannie Lee with Real Palliative Care.